we are interviewing the first rank holder of November 25 medical gastroenterology session, none other than Dr. Ravi Kumar. He has scored AML of 1 and CML of 1, the best possible pinnacle that is possible in this session. So, very proud of him. Congratulations, Dr. Ravi Kumar. Very, very happy to know the news that you have made it to the top. So, how are you feeling?
So I'm feeling very good that I was overwhelmed that interview, this competitions in my life has now over. Like I don't have to sit for more competitive exams. It's a very challenging thing.
Great, great. I can really understand these kind of competitive exams, how much of pressure it is, and you have so many things to handle. And once it is done with a result, which tells you that you probably don't have to give exams again, it's the best feeling ever. So I can totally get you. So, Dr. Ravi Kumar, I don't want to take too much time. Want to be as short as possible with a lot of pearls from you to the students. So, can you please introduce yourself? Like, where did you do your UG, PG, and how into gastroenterology of all the supernumerable branches that are available for you guys?
So I did my undergraduation from Maulana Azad Medical College, New Delhi. Then afterwards, I did my MD in medicine from All Indian Institute of Medical Sciences, New Delhi. And then I did 1 year of SRship from All Indian Institute only. Then I just appeared for this INISS November.
Great. So awesome. So a good journey. So is SRship required to do best in that particular branch, or you feel that it really doesn't matter much?
No, no. The I did SRship in internal medicine, not in gastroenterology, because there's no
Internal medicine.
seat of
Okay.
non-acad SR in gastro. But I thought that keeping touch in medicine will help me in, like, for general medicine. At least I don't have to reopen the book. So I was focusing more on the subject per se, like gastroenterology and hepatology, not reading more of the other subjects like cardiology, neurology. So it was passively being learned by the patients I see in the SRship.
Great. Awesome. So, from what you tell me, we can be sure that you're a passionate physician who took medicine. How exactly gastroenterology? There should have been some spark which started it. So, when did it happen and how did it happen?
So initially, I was not uh, aligned towards any particular subject that I have to do DM, because I used to like each and every subject during my MD medicine curriculum. But we were posted in different branches, so we had the exposure that this branch is requiring this much of effort, and what are the things which are done in these different branches. So I was not aligned towards any inclined towards any particular branch. But after my MD, I thought that I was appearing for first in November 2024 for INISS. So I was not sure that which subject I would have to write, because in INI you have to choose one subject prior to the examination. So I just filled the form of gastroenterology, because I thought that I know things of gastro, that I can even guess some things. Like I can't guess things in oncology because it's a whole different thing. Because so I appeared for the exam, and luckily I was able to come to the interview round. So
Great.
I also gave the interview. Then I thought that I know this subject, because when I gave the exam unprepared, till then also I was able to answer something. So I started reading the subject, and from January this year I started reading seriously towards DM entrance. So when I started reading, then I developed a liking towards the subject, that I used to read from Schlesinger initially. Then some of my seniors helped me with his notes, so I just added on this notes and build up. But I made my notes from myself from the Schlesinger. So reading that, not cover to cover, but important topics at least I read from Schlesinger. Then after reading, you develop a liking towards the subject. And then it was all like I want to only do gastroenterology. I don't want to do any other subject.
Great, great. So you read the textbooks and developed love towards the branch more and more, which was kind of irreversible over time. Great, good to know.
Yes.
So, straight to the best point you told me was, despite you had time to prepare, you didn't read cover to cover, which is a very important point. You focused on important topics, you had seniors to guide you. These are all really important key words which are telling, which are essential. So how did you prepare for the first part, that is the theory exam, where the like literally the whole country is participating?
So regarding strategy for the theory exam, so uh, one thing I will tell everyone who is preparing for gastroenterology, because one book you must have to go through, means should be your base, is Schlesinger, because questions are directly asked from the tables, from the images of the Schlesinger book. So you can't skip this book. So one base, and you have to just decide what important thing you have to read. You don't have to go line by line, because there are 131 chapters in this book. Only 50 to 60 questions are coming, so they won't ask from each and every chapter, that's for sure. And you can't predict that they will ask from this chapter. So you have to divide these chapters into three categories. What I did, one was the most important or the must to know topics, which are around 50 to 60 chapters of Singer, which are, you can't skip them. Then are the some less commonly asked chapters, like in some session they have asked question from this chapter, so you can read them, or at least see the image or important topics, subtopics of that chapter. And then there are some chapters which they are not usually asked, but this session, some even from the last chapter, one question was there, which we usually skip, palliative thing.
Correct.
But but in these chapters, you can, what we can do is to at least see the tables and images, not more than that. You don't have to read, because in the last 1 month we only have to do the high yield and concentrated topics, not that we have to again read everything from cover to cover. So in last moment we have to have the confidence that at least I know all the important things.
Great. So, you have also told a very important point. Divide everything into smaller sections and then divide that again into what's really important and you have to read, what is partially important where you don't have to read line to line, and some high yield topics which may come here and there and go. Fantastic. So, any guidelines you said you was useful for you to actually be updated? Any other books, any other website, any other textbooks equivalent that really helped you from
Yes,
guidelines and
so some I personally used my notes, was the base. Then the second thing I used was, there is a book of Schlesinger for MCQ. They
okay. Self review.
ask, self review book. So they ask questions which are not similar to the question which are asked in the INA. They are very long stem question. Sometimes it's very frustrating to go through these questions, but when you do this question, they passively develop a concept inside you, that which in this chapter, if each and every chapter, around 131 chapter is there, line by line chapter there's question, and but in each chapter there is not more than 10 to 15 question. So if you're at least for those smaller topics, smaller subjects, like uh, the third part of the third section of Sessinger, or the other topics are, you can at least go through the MCQs. So sometimes line by line MCQ is repeated from that also. Last year one
Oh,
MCQ was from that book. So at least the smaller topics, you will have a feeling that I have also covered this chapter also. This gives a
correct.
good feeling that I have not left something.
Correct.
So
So,
so so I use that book, along with there is a review book from Imad Kayat, that also I reviewed, sometimes just for revising things, not as a base, but just for revising fastly. The IBD in that book is very well written. There's a separate section, Imad Kayat's board review book. So
I
that
know.
these two things extra I used, along with the my notes. And for questions I didn't review much, anything else much, because in INA most important is the previous year question, which we can do, but and this बाकी new questions are formulated every time. You can't just rely on previous year.
करेक्ट, ऑलवेज देयर आर गोइंग टू बी समथिंग न्यू, कुछ ना कुछ नया आता ही रहते रहेगा. तो गुड. सो first is questions, then you went ahead the self assessment. How did you revise? Like so much to revise, now you'll have to revise also. Any strategies for revision?
So in January, I started, as I told, I started making my notes. So it was complete till March, and so in first attempt, I was not good on revision because I had completed my notes till mid-April, and I appeared in May. Last session I appeared in May. So at that time, I had completed the notes, but the revision part was missing. So I could not analyze things, how deeply questions can be asked. I thought I have marked correct, but it might be not perceived well the question. So then I started revising things, and I in this last 6 months I have more stressed on revising the topics rather than reading it. So I have read the things, then I just knew that these are the important topics which are asked in this chapter. So to improve my knowledge or to improve my concept, I used to read it multiple times or review it from, even from chat gpt. I used to review things which I could not understand. There was in my notes something sometimes there are many things in your note but you have not understood them. You just memorize them, but when you understand them then you won't have to memorize in the last, and it will become very easy in the last to revise things when you have
Absolutely.
developed a concept towards that. And
Great.
solving mcq from that book also helped in improving the concept for that.
Superb. So even using AI becomes important. At least when we don't
Yes.
understand, it will simplify a few things. That's also well told. It's a new point by you, which has never been mentioned before. Great going. Then comes the most important stage. You get selected to the interview round. How did you keep yourself calm? You know all the professors who they are going to ask questions. They might have their own specific topics, favorite questions, this, that. How did you handle the pressure of interview round?
So the interview I had appeared also earlier also. I knew the pattern that there will be three stations. In each station, they will start mostly with a long case, and then they will structurally ask question, and then end with some spotters. This is the usual norm for gastro interview. So, and the cases, your interview session was very good. Last time also I attended. This time also I attended. That you had given a list of topics which are usually repeated in interview, and this time also same topics were asked. Nothing, uh, they don't ask rare topics, they don't ask uncommon things, they ask common topics, but you have to know each and everything about this topic, like you are managing these things, not like you are just read the book, you are in the astro ward and managing things. They want that kind of preparation from you. So this time also so when they give a question, have to start with what else I will ask in the history. Don't directly jump to the diagnosis, don't directly jump to the investigation what I will do. You have to tell that I will further ask these things in the history, I will do examination also in this patient, which are commonly skipped. This time also I skipped in one interview, but these are the things you can improve. They will ask
Correct.
what will you do next. So there is a common thing that I will do ultrasound, but they want that they will then change the slide. Okay, you want ultrasound, but I did examination. Then you will think that, oh no, I should have told that I will do examination. So these are the things. So these are small things which uh, increases the marks in the interview. Rest interview is not that predictable. Sometimes you feel that it's not predictable. Sometimes you don't get marks. Sometimes you can get marks. So it's depends upon the perception, how per, how you perceive the interview, how they perceive the interview. So it's so I will tell that you should mainly focus more on till the theory exam. You should focus fully on the theory exam. Do your best. After the theory, you just start on interview. And in interview, you don't have to read each and every topic. Just do the focus thing. There's important topics which you have already provided the list. And in you can in the spotters also, they are important, like biostat spotters. You should know things related to that.
Great, well put. So concentrate more on theory, followed by once you get selected for interview, all that probably matters the most is answer like you are managing the patient, not what you have read from textbook. So you will have some practical nuances which you can only talk if you have probably managed a patient yourself, or probably have attended an interview mock sessions, which will definitely fine tune the topics, because we have fine tuned the topics over few years to probably tell that these could be the topics, and you'll have to maintain and then have an order. You cannot jump directly to investigation of choice, the diagnosis of what you are thinking. Go from history, examination, then investigations, because probably a long case would be arranged in that particular order even for the exam. So very well said, Dr. Ravi Kumar. uh, so really happy with your excellent rank. Congratulations. All the
Thank you.
best. You gave us perfect points at each step. Just to summarize for the students, I would want to tell that for NESS, medical gastro, Schlesinger is the Bible. Second, if you have more time, go through the self-assessment questions of Schlesinger, and then have a strategy for revision. Don't run out of time. Once you get selected for interview, go back for focused topics with a mock interview session, and when you're answering, stay calm and go in an order rather than jumping towards conclusion. Great, fantastic. Thank you, Dr. Ravi Kumar. Congratulations. Welcome to the Gastroenterologist Club. Soon we'll catch up in some other interviews. Thank you.
Thank you, sir.
Thank you, man. Thank you.